This presentation by John Daniel will discuss compounding for immediate use and fulfills the minimum knowledge training requirements in USP 797. This training must be completed prior to being allowed to compound initially and thereafter as defined in SOPs. Immediate use compounding. Immediate use compounding refers to the process of preparing sterile medications for administration to patients without delay, typically at the point of care. Key characteristic of immediate use compounding are timeliness. Medications are compounded at the time of patient administration or shortly before, ensuring that they are administered promptly to meet the patient's immediate healthcare needs. Low volume. Immediate use compounding typically involves small quantities of medications, such as single doses or limited volumes needed for a specific patient or clinical situation. Simplicity. The compounding process for immediate use is straightforward and does not involve complex manipulations or extended preparation times. Direct patient care. These compounded medications are often administered directly to the patient at the patient's bedside, in an operating room, or in other clinical settings. Reduced stability requirements. Immediate use compounding is designed for medications that are not intended for long-term storage. Immediate use compounding and the United States Pharmacopoeia, or USP. The USP is a standard-setting organization that publishes standards for compounding. Immediate use compounding is exempted from the strict requirements of the USP 797 standard, provided all these criteria are met. Aseptic techniques, processes, and procedures are followed, and written SOPs are in place. Personnel are trained and demonstrate competency in aseptic processes. The preparation is performed in accordance with evidence-based information for physical and chemical compatibility. The preparation involves not more than 3 different sterile products. Single-dose containers must not be used for more than 1 patient. Administration begins within 4 hours following the start of preparation. Unless directly administered by the compounder or administration is witnessed by the compounder, the CSP must be labeled with names and amounts of all active ingredients, name or initials of the compounder, the 4-hour time period within which administration must begin. Core competencies. Personnel compounding immediate use CSPs are trained and demonstrate competency in these core skills and foundational knowledge required to perform their job duties prior to compounding independently. Immediate use CSP component definition and related requirements: hand hygiene, gloving and garbing, selecting, cleaning and staging of compounding area, calculations, measuring and mixing aseptic technique and maintaining sterility, bud assignment, stability considerations, and storage conditions, labeling conditions and requirements, documentation of the compounding process. Competency number 1. Component definition. A component is any ingredient used in the compounding of a preparation, including any active ingredient, added substance, or conventionally manufactured product. USP less than 797 limits the number of sterile components used in immediate use compounding to 3. Competency number 2. Hand hygiene. At a minimum, hand hygiene must include wet hands with clean running warm water and apply soap. Lather hands by rubbing them together with the soap. Lather the backs of hands between fingers and under nails. Scrub hands for at least 30 seconds. Rinse hands well under clean, running warm water. Dry hands using a clean towel. Apply alcohol-based hand rub to hands. Competency number 2. Gloving and garbing. Medical-grade gloves are the minimum required PPE. Other personal protective equipment, PPE, may be donned as available and the situation warrants. Sanitize gloves with 70% isopropyl alcohol, IPA, prior to compounding and as needed during compounding up to administration of CSP. Change gloves if they become torn or punctured. Competency number 3. Selecting, cleaning, and staging of compounding area. Select and prepare a work surface that is free of clutter. Sanitize work surface with an approved EPA-registered one-step cleaner. Stage medications and supplies. This reduces the risk of introduction of particulate matter or biological fluids, and reduces the risk of mix-up with other products or preparations. Competency number 4. Calculations. Most medications are dosed as milligram of drug per kilogram, mg/kg, of body weight. The concentration of most drugs is expressed as milligram per milliliter, mg/ml. To convert weight from pounds to kilograms, divide body weight in pounds by 2.2. Calculate the patient dose by multiplying the weight in kilograms, kg, by the dose expressed in mg/kg. Calculate the volume of drug in milliliters, ml, needed by dividing the calculated dose in milligrams, mg, by the concentration, mg/ml. Competency number 4, measuring. When using a syringe to withdraw medications, the volume is measured at the final edge of the plunger position as pictured here. Competency number 4, mixing. Sanitize critical sites, e.g., vial stoppers, ampoule neck, injection port of N4 bag, with sterile 70% isopropyl alcohol wipes prior to puncture or entry. The image on this slide demonstrates a non-coring method of piercing a septum with a needle. Notice that the bevel is facing upward and away from the direction of force. Competency number 5, aseptic technique and maintaining sterility. Aseptic technique is defined as a process by which separate, sterile components, such as drugs, containers, or closures, are brought together under conditions that maintain their sterility. Requirements for aseptic technique. Engineering controls personnel hygiene and Garbian cleaning and disinfecting environmental quality, and control administrative controls quality assurance programs. Competency number 6, BUD assignment. Compounded sterile preparations, CSP, should always be assigned the most conservative BUD. The BUD for immediate use compounds cannot exceed 4 hours from the start of compounding. If administration does not occur within the assigned BUD, less than 4 hours, promptly and appropriately discard the CSP. Competency number 6, stability considerations. Prepare CSPs in accordance with evidence-based information for physical and chemical stability, including, but not limited to, approved labeling, mixing, and storage requirements, stability and compatibility studies and data. Consult the manufacturer's labeling, DailyMed, Global RPH, or Lexicomp for mixing instructions, stability data, and storage requirements. Competency number 7, labeling conditions and requirements. If the CSPs cannot remain in the direct line of sight of the preparer from the time of compounding until administration, label the CSP or individual dosing units if prepared for multiple patients with the following: names and amounts of all active ingredients, name or initials of the person who prepared the CSP, date and time from start of CSP preparation, exact 4-hour time period within which the administration of the CSP must occur. Competency number 7, documentation of the compounding process. When immediate use CSPs are compounded for more than one patient as a batch, refer to the master formulation record for compounding instructions and ensure a compounding record is created, retained, and readily accessible. The dispense preparation module or compounding and repackaging module in EPIC can be used to document compounding. Competency number 7, documentation of the compounding process. Here is a simplified compounding and repackaging procedure. Search for the medication to compound barcode, scan all ingredients, follow compounding recipe. On right side of screen, take pictures of syringes filled with medication prior to injection into final container, electronically sign, print a label. Competency number 7, documentation of the compounding process. Here is a simplified dispense preparation procedure. Scan the barcode on the label, barcode scan all ingredients, follow compounding recipe. On right side of screen, take pictures of syringes filled with medication prior to injection into final container, press, document waste. When partial vials are used, click Finalize when complete. In summary, immediate use compounding is the process of preparing compounded sterile preparations, CSP, at the point of care. Immediate use compounding is exempted from the requirements in USP less than 797, as long as certain criteria are met. Trained operators must use aseptic technique. Administration must begin within 4 hours following the start of preparation. The CSP must be labeled if not administered by or witnessed by the preparer.